Hello guys, welcome back to my channel. If you are seeing my face for the first time, welcome to my channel. This channel is about nursing, it's about OSCE, it's about relationship and about lifestyle generally. And if you are part of my returning subscribers, I say thank you for coming back to watch my videos. I love you. So today I brought something good, something better, and it's about the implementation station and evaluation station in OSCE. So this is what the implementation station looks like. I don't know, maybe it is visible to you guys. And the time for you to administer the medication is written here, which is assumed today is 18 o'clock. And during your own examination, ensure you note that in your paper and also read your scenario very well. The one I'm holding, it was Shirley has been admitted to cardiac clinics following shortness of breath and insertion, chest pain with swelling legs. Shirley's heart rate is 66 beats per minute. That means in this scenario, they wrote the patient's heart rate and blood pressure in the scenario. So you need to read your scenario properly so that you don't miss out the necessary points you need to note when you want to do your implementation station. This implementation station is for 15 minutes. Please, I beg you, manage your time very well. Don't just stand there and be reading like you're opening all the books one by one. No. Be quick with you assessing the book because you're expected to read through all of this. You're expected to read through. So within that 15 minutes, you are still going to administer, you are still going to do 2 identity check. So be fast with you going through the book and dispensing your drug. One of the main things to do under this drug administration is for you to read your scenarios well. That one is number one. Then secondly, wear your PPE. Then thirdly, when you go to the patient side, introduce yourself and gain consent. You will now come back. You will see a drug trolley. Then you will read through all of this, the name of the patient, the weight, you write the word, the weight of the patient, the ones only medicine, the oxygen, antimicrobials, all of them you are going to read through. But you should do that when you are dispensing the drug, and as you are dispensing the medications, be verbalizing the actions of those medications. In case, let me open this, like the ones only medicine in this medication administration chart, it is paracetamol. So while you are trying to dispense that paracetamol, you need to say paracetamol is for pain, is to relieve patients from pain. Anything that comes to your head, just talk about the action, even if you don't want to talk about side effects. I don't like to wallow myself. Talk about action and get away. Then remember to administer all the start medications you see. Sometimes they write start medicine at the beginning. So if it is due for your time, administer it, please. And always remember the time you saw in front of the medication chart so that you won't make a mistake by administering the medication that is not due. They always do one thing, like my own scenario while at the exam center. At the start medicine, they've administered paracetamol for the patient as a start dose. Under PRN, I was saying codeine. Then under regular medication, I'm saying paracetamol. So now 3 analgesics. Me, I've even administered the regular medicine because I saw paracetamol. Then now moving to PRN, I'm now saying codeine. So they've administered the codeine and it's not yet up to 4 to 6 hours that the patient will need to administer to take another paracetamol. Immediately I had to dispense the drug into the sharp box that is under the trolley. Then I verbalized that I can see it has been administered under PRN. It is not yet due, so I will not be given. So check your prescriptions very well. Go through it very well. Understand before you administer. And in case you are not administering any medication to your patients, please code it if it is due. If it is due, code it. The number for you to code are boldly written here. It's up to 10, 1 to 10. So number 1 is medication is not available, then you inform doctor or the pharmacy. 2, patient is off ward. 3, self-administration. 4, unable to administer. Maybe there's an alternative route required. Then start dose give. That's number 5. 6, prescription incorrect. 7, patient refused. 8, knee by mouth. Then 9, low pulse or low blood pressure. Then 10, you state anything. This one 10 is related to maybe the patient is allergic to medication. There's a document that I used to read for these medications that are common in OSCE. So don't even disturb yourself. Even if you don't know any medication, you don't know the action, and the patient is due for it at that moment, there is a digital BNF. Me, I saw an iPad. I've not used it before. Don't look me that yes, I've not used it before. So immediately before I even start the procedure, I asked the examiner, please, can I know how to use that? Because in our own OSCE, we use the book type. So I was able to look for paracetamol, and the examiner allowed it. So I know how to use it even before I started my medication station. So anything you are not familiar with, even if it is a digital BNF, please try to use it before you start your medication. Try to use it so that in case you don't know any action of a drug and the patient is due for it, you'll be able to search quickly, or maybe the dose you are not sure of it, you will search for it and know the right one. Medication is easy. Just know how to manage your time well. Then when you are done, you write the date you will give the drug, which is the exam date. Then you sign. When you sign, in case you did not administer the drug, maybe the patient is allergic to it, or the prescription, maybe the dose is too much, then you will code it. When you are now done coding, at this area, they put omitted doses. So you write what the patient, maybe the patient is allergic to, then you sign, you put date, you write the reasons, then the code. So ensure you put that, and after you doing all the documentations, you will now come here to feel it that you are the one that give this drug at this time of the day, because I'm your word. So the word is always written on top here. This one now is medical word, so you see it there and then pen it here. I think those are the main things you need to know under the implementation station. Just that 2 identity check, let it be ringing in your head. 2 identity check, allergy check, you going back to meet the patient, maybe the patient can swallow, saying the actions of the drug while preparing it, and when you want to go and administer it to the patient, then making sure the patient swallow the drug. Those are the main things. And document. Thank you. So in evaluation is for 8 minutes. I do advise people to use 3 minutes to pen down 1 or 2 things, because this is what is just a sheet. So behind here there's SBAR, so you can use 3 minutes out of your time to pen 1 or 2 things down, so that you won't just be left behind if you start to tell the examiner what you want to hand over here. So ensure you use just 3 minutes or 4 minutes. It depends on how fast you can hand over a patient to someone, or you can talk. So pen it down, then when you are done, you tell the examiner you are ready to hand over this patient. It is using the SBAR, which is the situation, background, assessment and recommendation. So note the area you want to know, the person you want to hand, because here they wrote and verbally hand over information to the staff nurse in a high dependency unit overseeing the patient care. So in your exam, it might not be the same thing with this one. It might be to the night nurse, it might be to the morning nurse, or it might be to another hospital or to a doctor. So anything you see there, note that you need to say it, that you are handing over to this person, you're handing over to the nurse, you're handing over to a doctor. When I was still preparing for my own OSCE, I don't know, maybe it will work for you, but let me say it to you guys. Maybe you can use it in your own preparation for OSCE, especially this evaluation station. For the situation, I use a code SPR. That S stands for myself, which is my name and my word. P stands for the patient, that is the patient's name, the date of birth, and the hospital number. While R is the reason for you calling. Now let me dramatize one situation for you. Okay, hello, am I on to a nurse at the high dependency unit? Okay, the examiner will answer you. Okay, I am nurse Agbola Sandra in the medical ward. I want to hand over a patient to using the S-2, and the name of the patient is so. The hospital number is so. The date of birth is so. Okay, no. Then after saying that, you will now move to the reason for calling, which is this patient is having a complaint of severe pain on the legs and chest. That's about the situation. No? Then you move to what? To the background. That background is like a full detail of what has happened about the patient. So the situation is just a minimal introduction, while the background is about everything that have happened. Then I use a code as well, which is Dr. Pack. DR for doctor, the short form of doctor, and Pack, PAAC. PAAC. So the one for D under the Dr. Pack is D stands for date of admission, the date the patient was admitted into your ward or to the hospital. Also, the D as well stands for diagnosis of the patient. This one now, the patient diagnosis is shortness of breath, cardiac arrest, and the patient has cardiac related disorder. That is what brought the patient to the hospital, and that's the diagnosis. Sometimes you might not see date of admission, but use your own exam day that the patient was administered today, clinical, and you use that one. Then the P that starts the pack, it stands for the past medical history. That past medical history, please ensure you say a lot of things under it involving the past medical history of the patient, both the social history, the drug history, anything history. Past is past. Say it. So that's why I said 3 minutes is enough for you to pen 1 or 2 things, so that remaining 5 minutes you'll be able to talk extensively about the patient and you won't miss out anything. So the A for the pack is allergy. So while you are saying the patient allergy, you should also talk about the patient's reaction to that allergy. Maybe the patient is allergic to penicillin and the reaction is rashes all over his or her body, all those things. Say why you want to hand over to your examiner. Then another A is assessment, but this assessment is the initial assessment you've done in your normal assessment station, that you maybe got a new score of 0 or a new score of 1. So all those things you were able to do, your blood pressure, your respiration, your oxygen saturation, you will say it under this initial assessment. While the C under this pack is concerns of the patient, the reasons why you want to hand over this patient from your medical ward to their own high dependency unit. So most times it's really visible in the scenario, you will see it. That's why it's better to read the scenario very well and understand, and you won't have to be racking your brain or anything when you want to hand over the patient. Why assessments? We are done with situation, we are done with background, we are done with, okay, now we are moving to assessment. That assessment is the initial, like your current observation. Now in this scenario, they usually give it to us. They wrote it here. Charlie's most recent observation were, it is boldly written in your scenario. So that's what we say under this assessment, which is the recent observations. Then we will now talk about the nursing interventions you've done. Maybe while the patient was still in our ward, I was able to position the patient properly, I was able to administer prescribed medication, I was able to give the prescribed oxygen, I was able to monitor the patient's weight. All those things you've done, just say it. And both the nurse intervention and the medical intervention, everything is still under the assessment for this ESPA. While your recommendation, ensure you pen down some recommendations too, because if you start talking, you might forget one or two things. So that recommendation is what you just want them to maybe to put more effort on while it is the patient is in their own ward or in their own unit or in their own hospital, or what you think the patient might need due to the increase in the maybe this oxygen saturation has now gone from it was 96 before, now it is 88. So your recommendation will be that please I can recommend that the patient that's coming to your ward will be placed on oxygen, then the patient should be monitored every hourly, the observations should be checked. Just recommend one or two things so that they will know you really know what you are doing. You are a nurse, right? Yeah, you know, so you will know one or two things to recommend for a patient that has a condition, any condition. I don't know the condition they might give you in your own exam. My own exam was ectopic pregnancy. So the patient is just coming back from the from the surgical room. So you know that they will do dressing, they will monitor the surgical sites, maybe there's any risk for infection, all those things, administer antibiotics. Just recommend one or two things for the under this ESPA too. That's all. Your 5 minutes done like that, and you have passed too. ESPA is just simple as that. ESPA, situation, background, assessment, and recommendation. I know maybe you can follow all these acronyms that I use, but it worked for me. You see that even all my practices, I do pen it down. It's easier for me to understand and to know what to say and not to miss out in anything. So that's all about the implementation station and evaluation station. So finally we are done with API. So maybe in my next videos I'll be sharing tips about other clinical skills. It might be also in administration, it might be anything, it might be high end, it might be subacute, it might be suctioning, because the new clinical skills are now more than what others or what we especially are expecting. So thank you for watching this video. I love you. Bye bye, and please don't forget to subscribe. Yeah.